Hi there. The reason I'm recording this video, it's my first one ever on YouTube, and I only wanted to record something that I thought would be helpful. I myself had scoured YouTube for hours trying to find a video to determine whether I wanted to have Lapiplasty surgery. I'm 55 years old, or I will be 55 years old this year, actually in a month, but I wanted to make sure that I had the surgery sooner than waiting until I was older to where there could be a longer healing time or any potential complications. I understand that if you wait, then you may not always be a surgical candidate and or you have worse problems like hammer toes, and I was able to avoid that by having my Lapiplasty surgery done before then. Oftentimes we want to delay the surgery because we know we'll be out for a time, and some people express concern over just how long they'll be out. With a Lapiplasty, there are some people that are out for weeks at a time. I have heard of people that have only been out for a week and then were able to work remotely the second week. I myself was out 2 weeks per my doctor's instructions, and then I worked remotely on and off the 3 weeks going forward. If you're not clear on what Lapiplasty is, I suggest you do your research better than I did, because I didn't find out until 10 weeks post-operative that they actually did cut and remove 2 parts of my bones. I highly recommend a few things before surgery. My husband thought of cutesy things like this little bell so I could ring it anytime I needed his assistance. I felt really bad using it, so I kept it to a minimum. Another thing which is invaluable is a scooter. Show to you here. And I was able to get around using this scooter, and I had this little removable basket. It was extremely helpful. It was hard to navigate at first, but then you become an expert after using it a certain period of time. You become an expert, particularly at backing up, which I'm not really good at, not even in a car. Another thing, I am 55 years old, or I will be 55, and my bathroom is a distance from where I sleep. So in the middle of the night, instead of traveling on that scooter while I'm under pain medication and risking potential mishaps and more injuries, is this portable toilet, which I felt very senior when it arrived, but it was invaluable in the middle of the night. And you'll see here, you can just remove this, take it to the toilet, take it out, put some soap in, rinse it out, put it back. The day of surgery, right afterwards, they give you a nerve block. In my instance, my nerve block was a few hours. I wanted to make sure I didn't have to worry about chasing the pain, so I was sure to take my pain medicine timely, so I never had to chase the pain. And I was really lucky because somebody gave me that advice, and I would highly recommend that to you. So as soon as I got home, maybe 2 hours after I got home, I started taking it. I was on Percocet, which I didn't know made you really nauseous. I called my doctor. He said to cut it in half, which really helped. Another thing that's extremely invaluable to know is, since that constipates you, you need to have some sort of stool softener. I did not have that. I ended up having my husband get something that just gave me cramps, and it would have been better to have a stool softener like Miralax. So for the first week, I just tried to keep myself busy. I found myself mostly just reading and exploring the internet as to what to expect that first week and not freaking myself out. My second toe turned blue. I asked the doctor if that was normal, and he did indicate that bruising was normal. It didn't look like a bruise. I thought that maybe I was losing circulation. One of the things that he emphasized is me moving my calf muscle to pump to avoid any blood clots. So this is the foot I actually got surgery on. And he said to just keep doing this, like right after surgery. And I actually started doing that the moment I got out of anesthesia. Yeah, I even started to move this toe because he emphasized that it was important that this toe move, so I didn't have any problems in the future as far as for range of motions, or he didn't even say range of motion, he just said just to avoid any future problems, and I took his word for it, and I'm glad I did. So to manage pain the first week, after the third day, I didn't really need the Percocet so much. I was just good with the ibuprofen. I was told sometimes ibuprofen can cause problems with bone healing, but it didn't really affect me since I took it such short term. Percocet has Tylenol in it, which was why I was told not to take extra Tylenol. So I guess if you're taking something that's not Percocet, it's probably fine to take the Tylenol. As far as, again, managing the pain, you need to keep your toes to your nose, keeping it level to your nose, and putting ice behind your knee. Also, just elevation, toes to nose. But I also have this, which I learned of like so many weeks after I really needed it, but I still use it now, like during those days that I feel like I have swelling. It's basically, you can stick this in the freezer. It's frozen now, and I did actually wear it this morning as I was just easing into the day after our workout, and it's just awesome. It's like, I really wish I knew about this like early. Like, I could have really used that the first few weeks after surgery, because I had such incredible swelling and just throbbing and just discomfort. Anyways, I just wanted to end this particular video just acknowledging and addressing what you can do to help with pain. I also take internally, there's these pills. I take tea relief, which is, I guess, a holistic way of managing pain. It has arnica in it, along with a couple of other things. I try to stay away from NSAIDs and Tylenol if I can help it, but I will take it if I'm in extreme pain, especially if I need to get some rest and go to sleep. I hope you found this video helpful, and I will continue to post more, I guess, week 2.